All right, so we're going to begin. Good afternoon, everybody. Welcome to day 6 of March Madness, Winer Wellness Week 2015. So I'd like to thank everybody for coming out today. Appreciate it, especially with the nicer weather out. Makes things very nice. My name is Mike Gallagher. For those who don't know me, I am a little background on myself. I'm a certified lifestyle educator. I've been in the nutrition industry for almost 20 years. I am only here during these wellness events to help answer questions. I pretty much have heard almost every question you can possibly throw at me in those 20 years when it comes to health. So, and if I don't know the answer, I'll get it for you, okay? But normally I travel around to different doctors' offices the rest of the year when I'm not here. Okay, so I work with a lot of different modalities. I work with medical doctors, some medical doctors in the area. I work with some DOs. I work with a lot of chiropractors. I work with pharmacists, nutritionists, kinesiologists, psychologists, hypnotherapists, nutritionists, did I say that? So again, a lot of different ways of looking at health. A lot of different ways. They all have their own way, but again, at the cornerstone of it all, every one of our programs, it always starts about the food, eating healthy foods consistently, eating healthier foods, exercise, reducing stress, and then taking the right supplements in the right dosing to get the fastest, quickest results. Okay, so that's what all of our programs are all about, okay? But at the cornerstone of it all is your stomach, okay? Is your stomach. And I forgot to mention one modality that I work with, and that is naturopaths. Naturopaths believe everything starts first and foremost in the stomach for every single health condition. So if you fix the stomach, if you heal the stomach, almost everything else will get better. Almost everything else. And naturopaths used to rule the world. Before medical doctors found the drug anesthesia, naturopaths were the primary care physicians for hundreds of years. Hundreds of years. Okay? So this is, when in doubt, you can never go wrong with helping your stomach out first and foremost. So we have a little diagram here, okay? Obviously with the foods. As I mentioned, that's number one. Number one, so if we're eating healthy foods and we prefer the Mediterranean diet, okay, lean proteins, know your sources, organic, as much as possible, fresh fruits and veggies, good seeds, good nuts, good fats. Okay, all that is in our brochure for you. You get the good bacteria going on in your GI tract. When we're eating the unhealthy foods, the processed foods, the fast foods, over time, not just one meal, but over time, yeast builds up, intestinal deterioration starts happening, toxins, parasites form over time. And then the next step is what we call leaky gut. Leaky gut, perforations in the lining of your gut that will then cause other types of damage throughout the rest of your body. So we're going to talk about that, how that works in more detail here in a moment. But again, this is at the beginning stage of what's happening inside your stomach. And I think most of us might know this. You see this advertised on TV now. Probiotics, especially, are advertised. But we've known this for many years. At least 70% of your immune system is in your stomach, the mucosa of your GI tract. I've seen some recent studies that have said at least 80% of your immune system. So if you're consistently getting colds and flus and constantly getting sick, let's start with your stomach. Let's get the stomach fixed. And a lot of your immune system issues will go away very, very, very quickly. And again, this is also the reason why we recommend probiotics, the good bacteria, because unless you eat 100% organic every single meal, every single day, which is almost impossible, you will have these different types of bad bacteria going on. So this is why you always want to use good bacteria, which we call probiotics, to battle the bad bacteria all the time. So it's not just when you're on antibiotics or if you have stomach issues, you should be on a probiotic. You should be on a probiotic every single day. So we know GI issues are one of the major reasons why people see doctors. Top 10 or top number 1 reasons why. And statistically, 70 million people have some type of GI problem or disorder. 300 million people in the United States, 70 million of them have a stomach issue. So do the math there, quite a bit, 1 in 4. Okay, so this is what's happening here with leaky gut, okay? This condition that I was referring to, and again, it's really the underlying problem of so many other health issues that you are having here. So, when you have these macromolecules that would normally be inside your lining of your stomach, inside your stomach, when you have leaky gut, these perforations, these tears, little minute tears in your stomach lining, these macromolecules now are going outside of your gut and they're circulating throughout the rest of your body, causing all kinds of havoc, okay? So in a nutshell, that's a really simplified version. That's what we call leaky gut syndrome. But this is really the major reason of all inflammation problems. So rheumatoid arthritis, eczema, acne, food allergies, irritable bowel, colitis, Crohn's, most of your autoimmune issues, I would say almost all of them, is a gut issue. It's a GI issue. So this is really hard for a person to think about because they might have rheumatoid arthritis in their knees or in their hands, and they come to us and they say, what do you suggest? And we're saying, let's fix the gut. And they're like, yeah, I know, but I told you I have a hand problem. And you're telling me I need to fix my stomach. And I'm like, yes, because this is why. This is the issue. We fix the stomach, all these other issues will be greatly reduced. Will be greatly reduced. Okay? So, another reason why people have major GI problems is they are self-medicating with these antacids, okay? Or the next step up is your proton pump inhibitors, Nexium, Prilosec, Zyrtec, right? Does anybody know, don't answer if you've already seen this presentation, but does anybody know how long you should be on Nexium? 14 days. That is correct. 14 days. Now, Nexium you can now buy over the counter. You don't even need a prescription from a medical doctor now to buy Nexium. So on the advertisements of Nexium, they flash this for like a millisecond on a TV commercial. Do not take for more than 14 days without consulting your doctor, even though you don't need a doctor to buy Nexium anymore. Okay? So the drug companies know about this. Medical doctors don't know any other options because they've never studied nutrition in med school, nor have they studied nutrition after med school. So you always keep that in mind. So they're just going to keep, well, I don't know what else to do, just keep taking your Nexium. But what happens after 14 days is that your own body's ability to break down food gets diminished. And so you become dependent or as I like to say, addicted to Nexium, to this drug, okay? And it's very, very, very hard to get off these drugs. We can do it, we can help you, it just takes time. The longer you've been on Nexium, the harder it is to get off of it. So it's a slow process, and we never want to go cold turkey. You always want to work with your prescribing physician and use less and less over time, and we'll show you how here in a moment. But almost half the country self-medicates on antacids. And how do they promote these on TV? Eat whatever you want. After you're done, take a Nexium. Sounds good to me, right? Not thinking about the long-term damage that this has. And it says it right on the directions. Nobody reads the actual directions of these drugs, which you should. But this is one of the major reasons why there's so many problems, stomach problems. These are not only meant to be taken short term, never meant to be taken long term. And antacids I used to see this a lot, take your antacid to get your calcium. Good for your bones. You don't see that advertised anymore because it's the worst form of calcium, okay? And it actually can be linked to causing heart problems and kidney stones and gallbladder stones, the form of calcium that they use in antacids. Okay, so that is furthest from the truth on the medications. The other major reason why so many people have stomach problems is the chronic use of nonsteroidals. Tylenol, naproxen, ibuprofen, aspirin. Okay? Does anybody know, don't answer this if you've already heard me speak, but does anybody know how long you should be taking an NSAID? Maximum length of time is 3 days, 72 hours. You should be taking Tylenol, ibuprofen, or naproxen. After 3 days, there are studies that have shown it starts causing this leaky gut, these ulcers, bleeding ulcers in your stomach lining. 3 days. It says it right on the directions. Okay? Yes?
So people are on like aspirin therapy for like heart disease or whatever.
Yep.
It's very, very, very bad.
It is very, 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 very bad. I would never in a million years take an aspirin for more than 3 days. Never, ever in a million years. Some of the newest research on aspirin is that if you take 1 aspirin a day, the chances are it will increase your chance for macular degeneration by 400%. If you take a baby aspirin a day, it increases your risk for macular degeneration 200%. There are so many other better things that you can take naturally than an aspirin. 1 is fish oil, 2 is vitamin E, 3 is garlic. These have been around for thousands of years. Okay? These are so much better for you than aspirin. There's some doctors that I work, pharmacists that I work with, that have told me that if aspirin came out today, it would be a prescription drug, but it got grandfather claused in, and so it is allowed to be sold over the counter. Okay? Aspirin is not meant to be taken long term. And this past summer, the FDA changed the way doctors are supposed to be recommending aspirin. This past summer, it's not the first line therapy that it once was because of the damaging effects that it has on your stomach. Yes? Fish oil is 1, vitamin E is 2, garlic is 3, and if you've had a heart attack or any major issue with blood clotting, nattokinase plus, nattokinase plus. That's an enzyme that does everything that aspirin does. It improves blood viscosity and it clears out blood clotting without any negative side effects on the heart, nattokinase. So come see me afterward and I'll show you that if that interests you. Okay? So this is a big problem. We know this. I did a whole talk on this a couple of days ago on the problems with NSAIDs. There are more people who die of taking their NSAID every day in the United States than there are people who die of AIDS worldwide. Okay? That's how serious this problem is. You just don't hear about it on the news. 13 million people take NSAID every day. Every day. 13 million people. 3 days. 3 days. So, another major problem. Now, the GI tract itself, amazing. The surface area, if we were to stretch out our entire GI tract, it's 900 square feet. That is the size of a basketball court that is in our bodies. That's how amazing our bodies are, the GI tract. So the whole idea, of course, is to help promote healthy promoting nutrients, molecules, and other beneficial substances through. But if you have, again, that leaky gut issue, that leaky gut, these molecules that are supposed to be inside your GI tract now are going throughout the rest of your body and causing all kinds of problems. So again, we talked about some of the issues already. Excessive sugar also can play a role. Of course, it can cause candida yeast issues. By the way, 3 out of 4 women have candida issues. 1 out of 2 men have candida issues. I was at a seminar a few months ago. It's a major, major health problem in the United States. Most medical doctors do not think that way because the current medical approach for candida is 12 months on the drugs, and it doesn't fix anything. Stress plays a role, of course, with everything, but especially GI. Long-term antibiotic use, of course, eating the wrong foods, food allergies, just to name a few. Okay, so get a little technical here. So leaky gut may be associated with the activation of what's called GALT, gut-activated associated lymphoid tissue. So the purpose of GALT is basically your first line of defense against all foreign invaders, antigens, bacteria, toxins. So think of GALT as like the Marines, okay? Foreign invader comes in and attacks it. So it does its job, it attacks it, but it causes all these other reactions, which then cause other inflammatory chemicals or reactions to be produced. So then it starts producing what's known as cytokines. Cytokines then fight these foreign invaders, but it also then destroys, and the activation destroys your other tissues. It does its job too well. It's hyperactivated. So this is the connection between the stomach and rheumatoid arthritis and other types of autoimmune issues, because it's destroying your other tissue cells because of this reaction. So it's like a domino effect that occurs here. So let's put this in real simple terms. Think of your stomach as a screen door. What is the purpose of a screen door? To prevent bugs from getting inside your kitchen, right? In the summer, causing all kinds of havoc. When there's a hole in that screen door, that's what happens, right? In this case, the bugs that are happening now in your stomach are now going outside your stomach and causing havoc to the rest of your body and attacking all your other major organs. So what we're trying to do nutritionally is we are trying to fix this screen door, fix the leaky gut, reduce the inflammation, heal the gut lining, what we call regenerating the GI mucosal cells, okay, and the tissue itself. Folks, the drugs do not do this. They do not fix the screen door. They block the screen door. And then this causes other side effects, which you then need other drugs to fix that problem, which cause other side effects, which you then need drugs to fix that problem. So then you get into the medical merry-go-round. So this is the difference between our approach and the drug approach. We are actually healing and fixing the gut. The drugs do not do this. Okay? Make sense? Okay. So, we can do all of that, fix that screen door, with basically one formula. And that one formula is GI Complete. GI Complete fixes the screen door. And we'll get into that here in a moment, along with probiotics and digestive enzymes. So that at the core, that is the program in a nutshell. Basically, with 2 or 3 things, we can fix the screen door. It's as simple as it gets in the nutritional world, okay? But we want you to have a better understanding of why we're doing this and what's happening here. So let's talk about the probiotics here. Okay, again, this is the good bacteria that feeds the bad bacteria or battles the bad bacteria every single day. So we have 4 options on the probiotics, 4 options. So the superbiotic, okay, the superbiotic is one of the strongest probiotics on the market. This is guaranteed 52 billion per capsule, 52 billion. Where would we recommend this? We recommend this for major GI issues, so we call them the big 4. Crohn's, colitis, irritable bowel, and celiac. Now, a person with celiac has a major issue with gluten, which is a protein found in wheat. And a lot of celiacs think all they need to do is just not eat wheat or gluten. And I always tell them, I always ask them this question. Number 1, how many years did you have symptoms before you were diagnosed as a celiac? And no one's ever asked them that question before, I can tell. And they look at me, they're like, a couple, few. I'm like, was it 7? And they say, yeah, how'd you know? Because on average, it's at least 7 years of symptoms before a person with celiac has been diagnosed. 7 years. So 7 years at least of eating gluten, all that damage on your GI tract. And you need to take something that's going to heal that GI tract. And so when I explain it that way, they're like, oh, no one's ever said it to me that way before. So it's one thing to avoid the food, it's another to heal the stomach itself. So anyways, the big 4, right? That's where we recommend this, the superbiotic, typically 1 in the morning, 1 in the evening, 2 a day. We would also recommend this as well with Candida as well, Candida. Second phase of our Candida program as well. So I'm just going to pass that around for you if you've never seen that before. Okay. Let's talk about the Frontier Biotics. So the Frontier Biotics is our basic general probiotic, guaranteed 5 billion. 5 billion, non-dairy. In fact, all of our probiotics are non-dairy source, which is actually pretty unique in the nutritional industry. Most probiotics come from a dairy source. Ours do not. Okay, 5 billion. So this would be for someone, once we get their major issue under control, we would transition from the superbiotic to the regular probiotic, or just as an everyday regular probiotic, which again, this is part of your basic fundamentals. Recommend 2 a day, 2 a day with this probiotic. This is comes in 180 capsules, so that's a 3-month supply if it's just for yourself, or of course your whole family on that. But that's our regular everyday probiotic. Okay, our Probzyme. Okay, so our Probzyme is a combination probiotic and digestive enzymes together in one formula. So it's really 2 things in one. So you can, if you prefer chewables, that's where this would fit in as an everyday probiotic. Or if you have any acid reflux, heartburn, things of that sort, minor GI issues. If you take 2 of these, usually the symptoms are relieved within 15 minutes. So it's basically a natural antacid is where the Probzon would fit in. Okay? So that's why when somebody says to me, what do you have for probiotics? I always just say, do you prefer a chewable or a capsule? This would be our chewable. The Frontier Biotics would be our capsule. Okay? Either one is good. They're both good. Just this one has additional digestive enzymes in it. And we have samples in the back there for you to try if you'd like to try. And the last one is our SBC. SBC stands for Saccharomyces boulardii. Saccharomyces boulardii. So there's 4 ways we recommend this one over the other ones. Number 1, if you're on an antibiotic or just recently finished taking an antibiotic, SBC, Saccharomyces boulardii, has the most published studies to reduce antibiotic-associated diarrhea. So we would recommend taking this with your antibiotics, and you can take it at the same time as your antibiotics. It does not need to be spaced an hour apart. 3 a day. 3 a day. So that's one area we recommend this one. And then when you finish this and you finish your antibiotics, again, transition to either the Frontier Biotics or the Probzon as your everyday regular probiotic. Number 2, Candida. Candida. This technically is classified as a probiotic, but it actually comes from the cell wall from yeast, but it's not yeast, okay? It actually has the most research to pull Candida from the body. Okay, so this would be really, really important formula if you have Candida issues. 3 a day. 3 a day with Candida, especially if you combine it with our Candy Kill. So that's our major formulas for Candida. Candy Kill, 3 in the morning, which is the strongest Candida formula on the market right now as it exists. So Candy Kill is 3 in the morning with food. SBC is 3 in the evening away from food. Okay? Third area is C. diff, which is running rampant in hospitals and also nursing homes. In fact, in 2013 in Pittsburgh, they called it a major epidemic, C. diff. And it is contagious by breathing on someone. Does not have to be bodily fluid. It's a huge problem, huge problem. So Saccharomyces boulardii has the most published studies to A, reduce C. diff if you have C. diff, which if you've ever had C. diff, you're constantly going to the bathroom, like 30 times a day. Okay, it is brutal, constant diarrhea, C. diff. Okay, very painful, very, very, very tough. 3 a day. Or to prevent C. diff, if I was going to hospital, I'm definitely taking this before I go, or nursing home. 3 a day. Lastly, if you plan on traveling to anywhere where the water quality isn't the best, so or going camping for the week or weekend, or Mexico, or somewhere where the water is known to be not very good, to prevent Montezuma's revenge, we start taking this a week before your vacation, 3 a day, and then take it during your vacation, 3 a day, okay? And it will dramatically reduce any chance of getting any type of GI problem on that trip. So that's where the SBC, 4 different ways to use this. Make sense? SBC, I'm just going to pass it around right here for you. 3 a day, this does not need any refrigeration at all, because technically it's not living bacteria like the other ones are. So you can take this on the plane, you can travel with it, you can bring this to the Mojave Desert, it's still fine. Okay? Yes?
Can you take that long term?
SBC, we would really transition, at some point, transition to the regular probiotics to rebuild the good bacteria. So it's really only meant to be 1 to 3 months, depending on the situation.
Like, I'm prone to getting C. diff. I've had it probably like 5 times in my life.
Okay, prone, so you know how difficult it is then, right? You can speak from experience there. We would take that along with the superbiotics if you're prone to be getting it. Okay, any other questions? So that's how we position. Yes, sir.
What foods really have gluten that you have to avoid?
Anything with the protein from wheat. Protein from wheat is the biggie. So that's your breads are obviously at the top of the list. Anything that comes from our bread, pizza, of course, crust, pies, cookies, you know, all your baked goods. Now there are getting better.
Brown bread or like dark bread?
Yeah, again, you got to really look at the labels. So there are more and more gluten-free options, but you know, we would really try to avoid those as much as possible. Okay. And by the way, most people are at least gluten sensitive, even if you're not full-blown celiac. I was at another seminar, 8-hour seminar, by the way, on gluten and celiac, thousands of published studies. The doctor felt at least 75% of the population is at least gluten sensitive. Okay? Yes. Did you have a question? See ya. Question?
How does fermented foods compare?
Fermented foods, right. So people, this is a great question. Some fermented foods are good. Some are good, right? But I always get asked a yogurt question, usually. Well, I eat yogurt, I'm good to go, right? Well, we're not fans of yogurt unless it's organic, Greek, plain yogurt, okay? Not the commercial yogurt because A, they put tons of sugar in it. B, they put tons of red number 9s and other types of artificial coloring in it. Or then you say, well, I'll just go sugar-free. Sugar-free, of course, has usually sucralose or acidophane potassium, which are banned in 75% of the world, by the way. And they actually increase your cravings for carbohydrates. So they're actually worse. Sugar-free artificial sweeteners are worse than regular sugar. So again, organic, plain, Greek yogurt is the only one that I feel comfortable recommending. But let's put this in perspective. You would have to eat 40 of those little yogurts to equal 1 of those probiotic capsules, the Frontier probiotics, okay? And that's 5 billion. That superbiotic is 52 billion. So it is impossible to eat enough of the good bacteria through your food. And that's why you need to supplement. So, okay? Yeah.
As far as a supplement goes, I have read that taking Greg's apple cider, organic apple cider vinegar, a teaspoon in a glass of water, does kind of the same thing. It's alkaline and it works with the acidity.
Right, so that works on a different level. That's the alkalinity, acidic connection, especially for like acid reflux and heartburn and indigestion. Bragg's apple cider vinegar is excellent. I usually recommend mixing that with olive oil and putting it on salad dressing. It's a really good way to take that instead of regular salad dressing, doing that for people, because that's a little bit easier to take than just drinking it straight by itself. But obviously you can handle that. But yes, that is another. There's a lot of great options out there. That's definitely one of them. But that is not a probiotic. That's working on the acidity connection, which we'll get to that here, I think, in another few slides. Okay, so we talked about all the benefits. Now, the program that we put together, we call the 5 R's. So here's the 5 R's. Number 1, remove. Remove the offending substances. So these are the food sensitivities. These are the food allergens, okay, that we're talking about. If you continue to eat gluten and you're a celiac, there's no supplement in the world that's going to fix the problem because you are continuing to take the food that's causing the problem, right? So we want to remove the problem in order for the products to work, the supplements to work. So remove the offending substances. 2, replacing the digestive enzymes, the fiber, and there's the stomach acid. So that's where apple cider vinegar can help. 3, reinoculate. This is the probiotics. This is the fancy term for that. Reinoculating, getting the good bacteria in the gut. 4th, repairing, fixing that screen door. What the drugs do not do, folks. They don't fix anything, okay? And last, relief, especially acute relief, especially your minor GI issues, right? Acid reflux, bloating, constipation, diarrhea, heartburn, indigestion. Those are your minor acute issues, and we can help you within minutes of all of those, okay? With this program. So there's the 5 R's, okay? We put it all together. So what formulas do we have to help with this? So again, we have a lot of options here. Microgon is an herbal tincture. Okay, so if you don't want to do pills or powders, we do have tinctures options for you. Also good for parasites as well. Paracleanse should be on that list. It's not, but it should be. Fiber also can be helpful. Lean greens can be helpful. Okay. Replacing, again, fiber, gastric HCl, and digestive enzymes. So let's talk about digestive enzymes briefly here. So we have 3 options. One we already talked about, the Probzyme. That's a combination probiotic and digestive enzyme together in a chewable. And then we have 2 other options. So Sobzyme is for your initial digestive process. Okay? So if you eat something within the first hour, you start getting bloaty, okay? Start feeling it gassy, things like this. Within the first hour, this is where the Sobzyme would be beneficial for. So this is in the initial process of breaking down proteins, carbs, fat, and fiber. Okay? As we age, especially 40 and over, we start losing some of our normal digestion processes. And especially if we've been on Nexium, Prilosec, or Zyrtec for more than 14 days, we absolutely lose these digestive processes. So you can do this a couple ways, Sobzyme. If you're bloating, eat something that you shouldn't, you blow up, gassy, you can take 2 of these, and within 15 minutes it usually relieves symptoms. So you can take Sobzyme that way. Or if you just want to take a digestive enzyme with every meal, just to prevent that from happening, you can do this one with each meal. So you can take it acutely or chronically. What's unique about the Sobzyme is we added an additional enzyme called DPPIV or DPP4. And this particular enzyme has the most research to help break down gluten and gluten protein. Okay? So this is very unique in the digestive enzyme world. So we added that recently to this formula. So this is a new and improved version of our formula Sobzyme. There's a teeny tiny amount of probiotics in there, but it's primarily digestive enzyme. Now, Betazyme is our other digestive enzyme. This is more for somebody who has issues 2 hours after they eat. They start getting bloaty, gassy, okay? Or if they do not have a gallbladder. The main function of a gallbladder is to remove excess bile from your body. If you do not have a gallbladder, you will always have problems breaking down fat, even taking a fish oil. So when people come up to me here and they said, I can't do a fish oil, I'm like, why not? Every time I take it, it burps back up. I then ask them, do you have a gallbladder? 999 times out of 1,000, they will say, no, I don't. How'd you know? Because that is the function of the gallbladder, is to break down fat. So this is a game changer. This is a lifesaver. You will notice this in 1 day. If you do not have a gallbladder, this will change your world. Okay? in one day. It works that well. But a lot of people have issues with their gallbladder. You might still have a gallbladder, it's just not functioning properly. So if you have a gallbladder, we can reset your gallbladder taking this. How we dose this for the first week, 1 with each meal. Then for 2 weeks, the next week rather, we're going 2 with each meal. Then the third week, we're going 3 with each meal. And then we reevaluate. We can reset and train your gallbladder to function properly. Okay, so it's a very, very unique formula. But if you do not have a gallbladder, this will be a lifelong formula. You will need this to replace your gallbladder. And oh, by the way, the medical doctors forget to tell you that little detail before they take your gallbladder out. Yeah. How many of those? Just 1 with each meal. 1 with each meal if you don't have a gallbladder. Okay? Fiber, I should add fiber in here too, right? So this is our fiber. We use it in a lot of our formulas, but we do sell it by itself. This is a very special type of fiber. It's called Fibersol 2. This, of all the fiber in the world, this has the most published studies. It's patented. It's odorless, tasteless. There's no grit to it. 1 teaspoon is equal to 5 grams of fiber. We recommend 25 to 30 grams of fiber a day. Now, we recommend you eating your fiber in your green leafy vegetables, whole grains, but most people aren't eating that. Again, I always say the average American is supposed to eat 8 to 10 servings of fruit and veggies. 8 to 10 servings a day. That's what's recommended now because the nutrients are so poor in our food supply. But the latest stats I've seen, the average American eats 3 servings of fruit and veggies a day, and they count ketchup and French fries as 2 of those 3. So that's my little joke for today on that. So a lot of people are not getting enough fiber. This is a really simple, easy way you can add it to anything. It's odorless, it's tasteless, and this will not spike up insulin levels. Most fiber on the market raises blood sugar and insulin levels. This does not. Very, very unique. Okay? Especially if you're constipated. Especially if you're constipated, we would add fiber, more fiber to your diet. Okay. Reinoculate, we already talked about with the probiotics. GI Complete will help. Repairing, GI Complete, so we're sensing a theme here. Repairing and then relief, right? So, acid reflux, heartburn, the Probzyme I mentioned, take 2. Within 15 minutes, those symptoms should be gone, taking 2 of the Probzyme. The diarrhea I mentioned, especially antibiotic diarrhea, the SBC, fiber can also be an issue there with diarrhea. And then constipation. Okay, so I mentioned fiber just a minute ago, that will help. But we do have another formula, I forgot to bring it up, it's called Frontier Cleanse. Frontier Cleanse is our colon cleanse. And so let's talk about constipation there for a second. Everybody should have at least 1 bowel movement a day. At least 1. We'd like you to have more. Okay? But let's start with 1. If you're not having at least 1 bowel movement a day, that's how we define constipation. So Frontier Cleanse is our colon cleanse. It's a capsule. It's very simple and easy, but it's very, very unique in all the different ingredients in the Frontier Cleanse. The way we would dose this is 1 hour after dinner. Okay, we take 4 capsules, all 4 at once, 1 hour after dinner. If you do not have a bowel movement that night or by the next day, then we bump it up to 5 capsules. If you still don't have a bowel movement, we bump it up to 6 capsules the next day. Most people 4 does the trick, but we've had people with major constipation who have not had bowel movement in days, if not weeks. And some of the pain medications and cancer drugs people are on, it affects their GI big time. And constipation is a huge side effect of these drugs. So even for the worst possible person, constipated individual, Frontier cleanses help them. It's just a matter of finding the right dosage, but for most, 4 does the trick. 4 does the trick. So if that is you, or you know somebody who fits into that situation, that's where the Frontier Cleanse fits in. Okay, so we talked about a lot of things here, but here's the program in a nutshell. GI Complete and the Probzyme. Okay, so GI Complete, we have it in a powder or we have it in capsules. If you have any major GI issues, and again, we count the major ones, colitis, Crohn's, irritable bowel, and by the way, we define irritable bowel as abdominal pain, bloating, constipation, and or diarrhea in the last 30 days continuously in a row, one of those 4 every day. That's how we define irritable bowel. So if it's not like once a week, no, it's every day. That's how we define irritable bowel. If you have one of those 4, we do 2 scoops a day. 2 scoops a day of the GI Complete. 1 scoop in the morning, 1 scoop in the evening till you start feeling better. Then we back it down to 1 scoop. Tastes like fruit punch. Tastes like fruit punch. Okay? So I'm going to pass it around for you. If you prefer capsules, we have capsules. The capsules, 7 capsules equals 1 scoop of the GI Complete. So that's a lot of capsules to take, but some people don't want to do any powders. So we have this as an option. So if you have any major issues, 7 in the morning, 7 in the evening, 14 a day until you feel better. And then we drop it down to 7. Okay? The Probzyme, 3 a day, or unless you have major issues, Superbiotics, Frontier Biotics. We talked about that, the Betazyme. But this is the most comprehensive program, and just 2 or 3 things that you can do out there. So what's in the GI Complete that makes it so special? First of all, glutamine. Glutamine is a very powerful amino acid. We're putting 5,000 milligrams in the powder, 3,000 in the capsules, so the powder is slightly stronger. But this will actually reduce the inflammation and heal or fix that screen door. A lot of supplement companies don't put this much glutamine, so this is quite a bit. Very important. Then we have this word, very long-sounding name, arabinogalactans. Arabinogalactans. But this comes from echinacea. So you might have heard of echinacea. It helps with the immune system, but it also helps feed the good bacteria, so it works together with the probiotic. And it supports normal regularity. Third ingredient, dimethylglycine, DMG, one of my favorite nutrients in the world, DMG. Nothing does what this one supplement does. We can say things about this that we can't say about any other supplement, but it in itself has a U.S. patent for inflammation, and it's the master methylator, meaning it will enhance every other supplement you take it. It's going to make it more efficient and more absorbable. So it's like our secret ingredient that no other supplement company uses. DGL stands for deglycerized licorice. So no, this is not Twizzlers. This is a different type of licorice. This is actually good for you. It's an herb. It reduces inflammation and helps soothe and relaxes the intestinal tract. Fourth ingredient, aloe vera, which again we sell by itself, but it's in here, has many properties. Antifungal, bacterial, and viral, cools down the stress, detoxifies the pockets. Don't think of your stomach as like a Route 28, full of potholes that they're trying to fix. That's your stomach when you have stomach problems. So the aloe just smooths it out and detoxifies. Slippery elm also does very similar things. Another herb, antifungal, bacterial, and viral, detoxifies as well. And then marshmallow root. No, this is not the same marshmallow that you make s'mores with. This is an herb that's been used for thousands of years. Again, soothes the intestinal tract, detoxifies as well. Next ingredient, zinc carnosine. This is a very unique, this is a combination. And so this is better than just taking zinc and just taking carnosine. It's a special bonding process that makes it 3 times more absorbable. There's actually over 20 published studies on just this one ingredient alone that helps with all GI issues, but especially indigestion as well. Okay? So that's everything that's in the GI Complete. There are some supplement companies that would be 3 or 4 different supplements. We put it all together in one. So I know it's expensive, yes. But if you added up other companies, that would be triple the amount. So that is the most comprehensive GI formula on the market, the GI Complete. Does that make sense? Why it's our number one? Okay. With the Probosome, I just wanted to mention here a couple things. 5 different strains of probiotics, 6 different digestive enzymes. By the way, this is what your stomach looks like if you have parasites, yeast, fungus. So I want you to think about this the next time you go to Mickey D's. Think about that the next time you reach for that ice cream or something you shouldn't be eating and you know you shouldn't be. Think about that visual. That's what happens inside your stomach, right? That's what happens. So look at this stat right here, probiotics, real quick. There's more bacteria in your digestive tract than the cells in your body, with over 400 different species, and there's over 1 trillion cells in your body. That's how important probiotics are, folks. That's why you need to take it every day. So these are just the different names of some of the more common probiotics. Basically, the whole idea, just to let you know, covers the entire GI tract. So with time permitting there. So let's pull out the brochure real quick, the GI Solutions. Everybody should have one. So this puts it all together. We made extra copies here for you, so if you came late, you can grab it when we're done. So this should make more sense now to you. Okay, so we put all the supplements there. We put your basic food guide right there. Things you should be eating every day. Moderate, rare, and absolutely positively never. Okay, right there for you. So, there it is in a nutshell.
Thank you.
Sure. Hopefully that makes more sense to you. If you have any of these issues, try this program for 30 days. That's all we're asking, to give it a chance, and it will dramatically change your life. Yeah.
Under the never column, it says high fructose corn syrup
Yep.
and seeds. What kind of seeds?
Let me see that.
The last one in the never.
I'm not sure what they're referring to on that, but I will double check for you.
Okay.
I will check for you on that.
Because like I'm thinking of chia seeds.
Chia seeds are excellent.
They're good.
That's fine, no problem. Unless you have sensitivities when you eat something like that, and that's something I'll say. Anytime you eat something and you have a reaction, whether you went out to dinner or whatever, write down, keep a food diary, and start really looking at that and recognizing the foods that you have reactions to, so you become familiar with those foods. Yeah.
Like under the never column, I eat peanut butter a lot.
Peanuts, peanut butter. Peanuts are the most mold-containing foods in the entire United States. Peanuts. Okay? So we much better prefer you to eat almond butter, cashew butter, things like that. We are not fans of peanuts. It's also one of your top food allergens out there. And you might not think you can handle it, but usually things that you eat every day that you love and crave are sometimes the things that you actually are sensitive to or even allergic to, and you might not be aware of it. So that's why we're not fans of peanuts. Okay, it has the most mold of any food out there. Okay, so all the other nuts are fine, just avoid peanuts. Okay, any other questions? Yeah.
Do you have to soak nuts and can you roast them, soak and roast or not because of the
Yeah, we prefer not to roast them. When you roast them, you destroy a lot of the enzymes. So eat them raw. We prefer to eat them raw, but yes, soaking them is always a good idea in this day and age.
How about grains? You soak grains and beans a very long.
Yes, at least an hour, we recommend that. Yes, in this day and age. Again, go organic as much as possible. Yes?
Is it true that V8 juice is worse than French fries?
Well, it depends on what concept you're defining worse. Worse is I would not do either personally, but I would probably say V8 is slightly better than French fries, but I would not do either one.
Not even the low sodium.
No, not even the low sodium. Okay. Any other question? Yes.
I came across this term, which I don't know anything about, I don't know if it's SIBO, small intestine bacterial overgrowth. Do you have any idea about that?
Yeah, that's just basically an issue. You know, it can be a leaky gut connection, some type of dysfunction going on. You're not making enough good bacteria. The bad bacteria is too much. So that's just another type of term for stomach problems. But usually it's a deficiency in the good bacteria. Okay? Yep. Any other questions? Makes sense? All right, my time is up, folks. Again, I have extra copies here. Please take some if you have any family members or family wasn't able to make it. But again, this will really help you. Everything's discounted. Now's the time to try this if you haven't. And have a really good rest of the weekend. Be safe. God bless.
Thank you.